Now for another Fox 6 House Call. Today's topic is hip replacement. Dr. Timothy Schultz is an orthopedic surgeon with the Orthopedic Associates of Wisconsin, here with more of your questions. And first of all, hip replacements are not all that uncommon these days.
There are hundreds of thousands of hip replacements done in the United States every year, and it's becoming more and more common. And as baby boomers age, it's predicted that in the next 20 years, the number of joint replacements is going to go up by 700%.
Wow, that keeps you in business.
Yes.
Let's talk about, one of our questions is from Jill. What are the alternatives to hip replacements?
Well, one of the best alternatives to hip replacement, this model demonstrates what a hip replacement is, whereby we remove the femoral head, the ball of the femur, and put a stem down inside of the femur that then fits into a socket. One of the alternatives that is now available is what is referred to as hip resurfacing, whereby instead of removing the ball, we simply put a cap on the ball that fits over the femoral head that then fits into a socket piece. And essentially what the advantage of that is that it preserves femur bone should there ever be a need for further surgery.
It's amazing. It's very mechanical. You don't think of your bodies that way, but it truly is.
It truly is.
Our next question is, how long is recovery these days from hip replacement? This is from Andy.
Well, the industry is really focused on a faster recovery from hip replacement surgery. We're using smaller incisions. We're using different types of incisions, different approaches to the hip that speed up recovery. Usually start people walking with a walker, crutches for the first week or two. They graduate to a cane or one crutch, and usually by about 6 weeks, people are doing pretty well.
That is amazing. Our last question for this hour, how long does hip replacement last? This is Kathy in Pewaukee.
Well, the traditional replacement involves a socket that has a plastic insert, and that plastic insert wears out. And the industry has come up with alternatives to that plastic, one of which is ceramic. As you can see in this model, this socket has a ceramic liner, and that ceramic is designed to last longer. The hope is that it'll last forever. Another alternative to the ceramic or the plastic is a metal liner. Metal-on-metal hip replacements are now quite common and quite popular. We tell people on average 15 to 20 years, but the hope is that we will get many decades out of the newer versions of hip replacement.
How do you decide whether to go with the ceramic or the metal? Is it the age of the patient, the activity?
That's a very good question. It really does come down to the age of the patient and their activity level. The younger the patient, when they decide to have hip replacement, more likely we are to choose some alternative to the traditional plastic liner.
Dr. Schultz, thank you. You're going to stick around because we have more of your questions still to come in this hour, and don't forget our live web chat from noon until 1 today. You can join by going to fox6now.com. This is fascinating, Rob. You don't think of your body like all the things that connect and work together until they don't work.
Yeah, they work just fine until they don't.